Hi everyone, in today's video we are placing some V-Soft PDO smooth threads into a patient's acne scar, as well as treating some masseter temporalis for headache and a little bit of frontalis and glabella as well. So starting off, I am using V-Soft Lift 31 gauge by 30 millimeter smooth threads. This patient had a cystic acne mark that left a scar. It's a little bit difficult to even see on the camera, but it's something that quite bothers her. So every time she comes in for her neurotoxin, we go ahead and just throw in a couple of those smooth threads. This is really beneficial for acne scarring, just because not only are we getting a little bit of subcision by actually placing that needle through the tissue and helping break up some of that fibrous tissue from the scar, but we are also leaving behind that PDO thread that is going to help stimulate collagen and help soften that scar over time. Treating in the frontalis with threads can be a little bit difficult just because the tissue is quite taut, especially on a younger patient. As we're treating here, she has fantastic tissue. So I just use that other hand to help glide that thread, but it is going to be a little bit more difficult to push in the frontalis versus if you're somewhere lower in the face. Now we are going in and treating this patient's frontalis. She is starting to get a static line right above like where that scar is. So for her, like I said, this patient is very young. So this is a very minimal dose, but that area does bother her. So since we are treating her frontalis, we have to treat that correlating depressor, meaning her glabella. But again, we're just doing a minimal dose because she is on the young side. But that static line that she's starting to get right where that scar is again just bothering her. So we're just doing a minimal dose to help soften that area, but just ensuring that we're treating fully across that entire muscle so we don't have any muscle recruitment. Now going in and treating our glabella, I am just using my other hand to help support that muscle. Again, we are doing quite a minimal dose for her just because she is on the younger side. We are treating both her procerus and her two corrugators, both the medial and lateral portion. She also gets headaches, so treating the glabella can actually help with headaches as well, helping to reduce some of that tension. So, she does get that added benefit as well. For her, we treat both superficial and deep masseter, which we'll be doing here momentarily, but she does clench at night and she does have a mouth guard that she wears as well. But treating that muscle helps with that tension. And we cannot separate when we're biting down, we're activating both our masseters and our temporalis. These are both muscles of mastication. So it is definitely a contributor to the headaches that she's been getting. So when I am treating someone who clenches or grinds and also gets headaches, I am automatically treating both because we cannot function one without the other. So if we're treating one, the other is going to try to compensate and recruit and can cause more discomfort. So I'm always treating these muscles in conjunction. For her masseters, I did 2 injections to ensure equal spread. And then for her deep masseters, I'm always injecting it back towards the ear, and I'm typically right in line with that tragus of the ear. And then again, for her temporalis, I am just having her bite so I can feel where she is activating and going ahead and placing my units.